Hello, everyone. Sorry, I had a crying puppy, and this little one needed my attention because she could hear me in the other room and was not happy that I wasn't giving her attention. So this is my 5-month-old puppy, Frankie. See? You say hi? And she's a little bit needy right now, so we're just gonna hold you. Okay, can you be a good girl for me? While I do my chat? Thank you. Please and thank you. Please and thank you. Okay. Well, welcome everyone. It is exciting to be with you today. It is Monday. Hi. Hi, baby girl. It is Monday and it is May 12th, which I cannot believe is even possible. Here we are. Hello, Facebook Live support chat. Welcome all. As people start to log in, don't forget to share this on your personal Facebook page. Anyone who writes shared in the comments will be entered into a drawing. I'm going to do the drawing after today's chat. Thank you, Carrie, for sharing it. And just so you know, any winners that are in the US, I am going to mail all your gifts at the end of May because it just makes more sense to be efficient with my time that way. So don't worry if you haven't. Excuse me, let down. Down right here, okay? Right here in my lap. So that's how I'm going to do it. So I really hope that everybody shares this so that you can get entered into a drawing. I'm really excited for that. It is May 12th, which means we are 2 weeks into Lupus Awareness Month. I cannot believe it. I'm excited for all the things that we have been doing and will be doing the next week. And our hope is to continue to provide support and resources to the lupus community and their caregivers throughout this month, pushing for more awareness, more research to prompt more advocacy in our medical institutions, our government, and beyond. Hi, got my little puppy on my lap. Jeez, this is gonna be fun today. Woo boy. Let me say hello to anyone who is new for the first time. My name is Kelly, and I'm the creator and executive director of this Portland-based nonprofit, More Than Lupus. And if you're unfamiliar with More Than Lupus, we are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients to connect and to grow and to inspire each other throughout the peaks and the valleys of our lupus journey. And I say our because I have lived with systemic lupus and multiple lupus overlap conditions since the age of 11. And we believe at More Than Lupus that no matter your background, you should be treated with equity and dignity and taken seriously. This dog right now, oh my gosh, quit clawing my arms. Stop it, stop it. Just settle down, okay? Just settle down, okay? Yeah. We want every patient here to feel heard, to feel seen, and to feel valued. This is especially important if you're newly diagnosed with lupus and you're just finding us. We see you, we know how overwhelming this can be. And if this is you, we really recommend that you check out and encourage you to check out our website, morethanlupus.com, because navigating this illness can be tricky. And we have a plethora of blogs on our website curated for lupus patients in every facet of their life and every step along the way. So we do have a few updates. It is, as I mentioned, Lupus Awareness Month, and we are having our 6th annual Take a Loop for Lupus fundraising and awareness walk this coming Saturday, May 17th at Peninsula Park at 10 a.m. We really hope to get a good crowd. There was a great crowd last year. We do it early to avoid peak UV hours. So please come, join us. And if you can't be there, please consider donating because we are really short on our grants this year because of the shift in the presidency and our grants being cut and funding being cut. So please, any dollar makes a huge difference. And the night before we do our Take a Loop for Lupus fundraising walk, we are doing our 2nd annual Dance for a Cause fundraiser at the Edge Fitness Edge Family Fitness Center in Wilsonville. And so that's going to be May 16th. We had a blast last year. It was so fun, and we hope to make it even bigger and better than last year. I took my first dance class at around 3 years old. I was very involved with dance and through grade school until I contracted Epstein-Barr virus, and I went straight from the dance floor to the hospital floor and wasn't able to move my body for several years. Movement and dance are passions of mine. And as we know from Dr. Thomas, he is a huge encourager of his patients to dance because it helps with mobility, it helps with strengthening, it helps with joint range of motion, and it also helps with your mood. It can help with depression and anxiety, but also cognitive brain fog. Dance is a series of movements in patterns, and that is really good to stimulate your brain to help with memory, with clear thinking, and with just word recall. So I am a huge encourager of people who have lupus or any chronic illness to move your body as much as you can. And my way that I like to move my body is through dance. So 6 to 7:30 this Friday, Dance for a Cause. We are so excited at the Edge Fitness in Wilsonville. 6 to 7:30, already said that. Come and see some of your favorite instructors, or local instructors. They're going to lead us through a great workout with some fun and easy to follow routines. So super excited for that. Thank you everyone for joining right now and for sharing. We've got people from Mexico joining, Chicago, East Coast, Washington, West Coast. This is great. Additionally, we will be having a virtual event for Lupus Awareness Month. Dr. Thomas, who wrote the Lupus Encyclopedia, will be presenting what people need to know to live their best life with lupus. And that's going to be happening on May 31st, which is a Saturday. And that's going to be at 1 p.m. Pacific Standard Time, 4 p.m. Eastern. I will be in Hawaii, so that'll be 10 a.m. my time, Hawaii time. So we're really excited about that. What people need to know to live their best life with lupus. You are not going to want to miss that. And that is last day of the month, May 31st. We're going out with a bang. So put that on your calendar. It'll be live right here on Facebook. And no registration required, no link required. You just have to like us and you'll be able to watch our event. Lastly, all of our virtual events are up on YouTube, and please check them out. We have the Getting to the Heart of the Matter, the Kidney Nephritis virtual event, both with Dr. Thomas. He's an incredible resource that we have here and a wonderful way to remove that barrier to care, to be able to ask questions that maybe you don't have the time to ask in your doctor's appointment. Hi. Yes, you're just being very vocal. Guys, this is my dog. This is my puppy, Frankie. She is 5 months old. She did not want to be in the other room when she knew I was in here. My husband is not home right now, so I'm doing my best to hold her, but she still wants more of my attention. You do. You just want so much attention. Hey, I've got something serious to talk about, okay? It's Lupus Awareness Month, right? You just have to be patient. Yes. Okay. Before I go into our topic for today, I'm going to give you a brief disclaimer since I tend to get ahead of myself and I'm a little bit distracted because I have a mini dachshund on my lap. So here we go. The More Than Lupus, the More Than Lupus Facebook Lupus Live support chats are aimed to be a positive and open space where we can both give and receive support and encouragement from others. I am not a doctor. I'm not Kelly MD, therefore I cannot give you medical advice or diagnose the symptoms that you may be having. All that we can do here is provide you with information that hopefully you can take back to your doctors and have an open and honest conversation about what is the best course of action for you. Additionally, this group is intended for those living with lupus or lupus overlap illness. It's also intended to provide support and encouragement to those who know someone living with lupus. However, if you don't fall into these two categories, this is not the right chat for you. So please keep all comments positive and any inappropriate material will be deleted. All right, I'm going to be right back before we delve into our topic. I'm going to go see if I can put her in her little pen. So say goodbye. Say goodbye, Frankie. Hold on. Okay, guys, sorry about that. Ooh, that was a little bit a little hard. All right, so today we are going to talk about how so often people think that lupus is contagious. We posted that infographic today. No, not contagious, correct? Not contagious. However, lupus does impact the blood. So we are going to talk about lupus and the blood. Wait for that. There we go. Dr. Thomas once said to me, and I'll never forget it. And I said, "Can I quote you on that?" And he said, "Yes." It actually is in his book as well. He said, "You cannot talk about lupus without talking about the blood. The two are intricately entwined." So we are going to go there and we're going to talk about the blood. So if you want to blame one system in the body as the instigator of developing lupus, it would have to be the blood. That's where it all starts. And for many living with the disease, that is where many issues can arise. In fact, abnormalities in the blood cells are some of the most common problems that are seen with people with systemic lupus. And a lot of patients wonder why. Why is the blood so impacted by this illness? And it's important to go back to the beginning and something we say here all the time, and that is, oh, great, we got lots of Washingtons here. Sorry, I got distracted by new people. Hi, new people. And that is that lupus is a chronic inflammatory disease that is caused by your immune system, which is your body's natural defense system, attacking your own cells by mistake, right? And when that happens, that causes inflammation, and that inflammation can cause tissue damage, and if it's not treated, organ failure, and that gets really, 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 really bad. So it's overactive blood cells that are attacking your other cells by mistake. Those overactive blood cells, those white cells, are traveling through your blood and your lymph systems, and those can be a catalyst for inflammation and issues. And even though there is no single blood test to determine if you have a lupus diagnosis, your blood is very important to explore in the process of steering a diagnosis. It's going to give the doctor a lot of tips and information about what type of disorder you may have, what type of autoimmune issue you may have, where your illness is presenting. It can help your doctor determine disease manifestations and through analysis support a potential treatment as well. Now, around 85% of lupus patients are believed to experience issues associated with the blood. And this can present with a antibody abnormality, with clotting problems, low red and white counts, swelling in the blood vessels, and etc. And I'm going to just take a few minutes to talk about how lupus impacts the blood and how hematologists, which are blood specialists, there are doctors who specialize in blood disorders, that's a better way to say it, can work with your rheumatologist to elevate and to treat lupus blood, to evaluate and to treat lupus blood disorders. Oh my gosh, these dogs today, I tell you, I'm like, I've got things to do. I got things to do. Where is my husband when I need him? Hopefully they'll simmer down. Now, your blood makes up about 7 to 8% of your body weight. And blood contains three main components. I know I've talked about this a little bit before: red blood cells, white blood cells, and platelets. And blood cells are primarily produced in the what? Do you remember this from before? The bone marrow. And that is where new blood cells are being created to replace old cells that have run their course and are being removed by other organs like the spleen. Now, red blood cells have the heavy responsibility, heavy, get it? Because they carry a lot. They carry oxygen. That's what they carry around the body. They also contain an iron-rich protein called hemoglobin that carries oxygen from the lungs to the rest of the tissues in the body. Really important job. And hemoglobin is responsible for giving blood the red color. When oxygen binds to it. So it's the hemoglobin plus oxygen that causes it to be red. Hold on one second. And okay. All right, refresh your page. Thank you. And now I have notes here. Now I've lost my. Okay, here we go. So unoxygenated, okay, here we go, yes. Unoxygenated hemoglobin also causes the blush purple color of fingertips and toes that may occur in Raynaud's phenomenon. And that is why your veins, when you see them under your skin, appear blush in color, kind of purplish in color. So that is why, it's the oxygen needed. Now, white blood cells are an essential asset to the body's immune defense, and they are the ground soldiers that fight against cancer cells and viruses and bacteria and toxins and unwanted infectious diseases and foreign substances in the body. And your platelets, last but certainly not least, are your eternal and internal band-aids. They help your blood clot when your skin is cut. Now, plasma is something else that's found in the blood, and that is a blood component containing electrolytes and glucose and hormones and various nutrients as well. So all of this stuff makes up your blood. And there are different ways that lupus can impact the blood. And sometimes it's caused directly from the illness, and sometimes it's caused from medication. Sometimes it's a secondary issue that is just along for the ride. But the first thing that I'm going to talk about is anemia, because anemia is something that many of us have. It is one of the most common blood disorders in lupus patients. And anemia affects up to half of people living with lupus. At one point or another, you probably will have anemia. Anemia is defined as having too little hemoglobin in the blood. So too little hemoglobin in the blood. And there are many reasons that someone with systemic lupus may develop it. And it's important to figure out exactly why someone is anemic in order to treat it appropriately. And there are several types of anemia, but the two most common types of anemia found in systemic lupus are iron deficiency anemia and anemia of chronic disease. So iron deficiency anemia and anemia of chronic disease. However, vitamin deficiency anemia, aplastic anemia, bone marrow disease anemia, hemolytic anemia, sickle cell anemia, those are other variations of the disease as well that can be found in lupus. Most systemic lupus patients with anemia have mild anemia, which means a hemoglobin of 10 or higher. And sometimes it doesn't really impact you that much. But if you are feeling an enormous amount of fatigue and weakness and you're very pale, those are some of the first things that you may feel from that anemia. And it's important for you to reach out to your care physician and ask about getting your anemia, your levels checked so that you can get it before it gets too low. Other symptoms of anemia are, like I mentioned, paleness, sometimes an irregular heartbeat. That's usually how I know, because I have like an extra skippy beat. If you're dizzy, if you have cold hands and cold feet, I know we all do anyway, right? And it's a little tricky because a lot of these symptoms can be like normal lupus symptoms. But if you feel that it's just outside of your normal lupus symptoms and something just feels off, I encourage you to get to the doctor and have your doctor do some extra steps. Um, hold on. That's so weird. I just blocked that person and their comment, and then someone else with a different name said the exact same thing, and I blocked their comment. What is the deal? Okay, guys, sorry. Can you refresh your page again? This is not what I need today. We're having some spammers here. That happens sometimes, and then I try and delete them, and then sometimes they log in under a different account. Yeah. Really special today. It's frustrating because I have notes and I like to stay focused, and then I get distracted by this stuff, and then I lose my place in my notes when I was on a roll. Not okay. All right, so I was talking about the symptoms of anemia. Treatments can vary from taking supplements to having infusions, like blood infusions or bone marrow transplants for severe cases. So iron deficiency anemia can be helped by sticking to a healthy iron-rich diet. But if you have an inherited anemia that is genetic, like sickle cell, talk to your doctor about any risks and things that you should be doing, and please, please, please stay on top of all of this. So that is number one. Number two, antiphospholipid syndrome. Yes, 30 to 50%-ish, numbers are always changing, of people with systemic lupus have antiphospholipid antibodies. People with lupus have dozens of antibodies, and all kind of fall a little bit differently and impact their disease manifestations a little bit differently. One of the antibodies that could be potentially problematic, I should say, are the antiphospholipid antibodies, which 30 to 50%-ish of people with lupus have. The presence of these particular antibodies in the blood can potentially cause an increase in blood clots. That's why it's really important to be tested and to know if you have these. In fact, 50% of people with these antibodies develop an increased clotting issue over time. And these issues can lead to DVT, which is deep vein thrombosis, or blood clots in the lungs. That's known as pulmonary embolism. Blood clots in the arteries and brain. That's known as a stroke. Heart attacks and increased pregnancy risks, complications such as miscarriage. And I just want to take a moment and stop there, because many women do not know about this, do not know that antiphospholipid something may be something that they have and that they're dealing with. And if they do not know that when they are starting to plan for a family, and they are not speaking to their doctor about every way in which their lupus impacts them, and their doctor maybe doesn't know to check that, they could have a miscarriage. And there is a simple one thing that they can do, which is very simple, is you take a baby aspirin every day. And something as simple as that can save you the heartache of losing a pregnancy, which, having lost a pregnancy, it's just heartbreaking. And there's many women out there that have multiple miscarriages. And it's something we don't talk about enough, and it is incredibly devastating. So please, please, please talk to your doctor if you're family planning about antiphospholipid antibodies if you're positive, what that means, and getting on something even as simple as one baby aspirin a day could help counteract that. And so when someone has antiphospholipid antibodies along with blood clots in pregnancy or other complication, it is called antiphospholipid syndrome. Okay, many of you are aware of this. But just to be clear, blood clotting is not always a bad thing, right? We need it. The body's blood is usually in a liquid state. And when a person experiences an injury or a trauma or has surgery, the blood thickens and clots through a process called hemostasis. And that stops the blood from bleeding more. However, with lupus, of course, sometimes the hemostasis process is too active and the blood clot can form that shouldn't be there. And that is what can cause problems. So the result is a blood clot or a thrombus. That's the fancy word for blood clot. And sometimes if the blood clot is made when it shouldn't be made in a place that's not where it should be, the blood clot can detach and travel somewhere else in the body, and that's called an embolus. And traveling blood clots can be life-threatening and very, very dangerous. Blood clots in the veins can travel to the lungs, the legs, the arms, and the brain, and those can cause strokes and pulmonary embolisms and DVTs. And thrombosis in lupus is often, but not always, associated with the presence of these antiphospholipid antibodies. So there are many different tests that are used to detect these in the blood, and I'm going to put them right here. These are the ones you need to talk to your doctor about. Guys, I'm so sorry with all the distractions today. What a day. I'm doing my best. So these are the ones to talk to your doctor about. Anticardiolipin test, anticoagulant test, the glycoprotein, the false positive syphilis test, and the antiphosphatidylglycerin antibodies. Ooh, that's a mouthful. Okay. What should I do with the dogs, guys? Is it super distracting? So I can put them outside. Or should I powder through? What do you think? It's distracting to me, that's for sure. Oh my gosh. Okay, hold on one sec. I'll be right back. I'm back, guys. This has been between the spammers and my puppies, this has been really interesting, hasn't it? Oh gosh. Okay. So as I mentioned, the blood clots, the antiphospholipid antibodies, they're all there. Those are the ones you need. Those are exactly the ones you need to test for antiphospholipid syndrome. Okay. It's very important before starting a family to have those tests done before you start planning, before you start trying to conceive. Okay, very, very important because it can determine if you have pregnancy complications or not. As I mentioned, many women are unaware of this issue and experience pregnancy loss, which is devastating. Sometimes you need to be on blood thinners, like warfarin or heparin for the rest of your life to prevent this. It's better to be on a blood thinner than to have a stroke, right? Or a pulmonary embolism. So it's something you just have to do. The next thing, besides we talked about anemia, we talked about antiphospholipid antibodies and antiphospholipid syndrome. Another way that the lupus can impact the blood is vasculitis. And vasculitis can occur in any body organ, but most commonly affects the skin in lupus patients. And it's defined as inflammation and damage to the walls of the blood vessels. Now you're thinking, we're talking about the blood. Why are you talking about the skin? We are talking about blood, which also includes blood vessels. And it's the blood vessels that can get inflammation. It can be mild or it can be severe. It can be very painful or it can be hardly noticeable, but it can be disabling and fatal even in some cases. It occurs in lupus when the immune system mistakenly attacks the blood vessels. And lupus is the cause of vasculitis in most cases. However, rarely someone can have an overlap syndrome with a lupus unrelated vasculitis, such as giant cell, which someone was just talking about that, right? Mast cell, oh yes. And what else? Yeah, so lots of different things to go on with that, like with that. And the symptoms of vasculitis can vary depending on where the inflammation is. Doctors usually diagnose vasculitis by doing a complete blood workup and sometimes a biopsy as well. And the treatment is directed toward decreasing inflammation of the blood vessels. And also may include, unfortunately, steroids, prednisone, or other types of steroids, or immunosuppressive therapies. So thrombocytopenia, that is something that is another type of blood disorder, and that is when you have antibodies that attack and destroy blood platelets. And this can occur in 10 to 25% of people with systemic lupus, causing platelets to decrease in number. And most patients have mild or low platelet counts and don't really have a problem. But the symptoms include bruising, bleeding from the skin, the gums, the nose, and intestines. This is something that I have had when I was younger as well. And what's interesting is that some people will actually develop this before developing SLE, which is what happened with me. I always had bruises, my gums bled, I had terrible bloody noses. And it's called immune thrombocytopenia purpura, or ITP. It also used to be called idiopathic thrombocytopenia, which means that it's usually in children or in teenagers, and 10% of people with it develop it before their SLE comes out. So very interesting. So treatment for this includes high doses of steroids, immunosuppressants, sometimes Rituxan, Benlysta, and IVIG are sometimes used as well. So there's also times with a lupus patient where the blood is impacted by having too little white blood cells, or too little types of different types of white blood cells, leukopenia and neutropenia. And that is when your body is so overworked. Sorry. What's happening now? Somebody else at my door? Oh my gosh. So that's because your body is fighting off its own cells and fighting the wrong cells by mistake, and spending so much energy doing that, that your white cells are kind of not doing their job, and you have a drop in the number of white blood cells and a decline in the number of them as well. And if your complete white blood count is low when they test it, it's called leukopenia. This is something I also have. Patients with systemic lupus often experience this. It just makes you more vulnerable to infections, okay? Something they look for, and they kind of find your baseline and see how low your white cells are, and if they dip even more, do we need to back off some of the medications? Because some of your immunosuppressant medications will make this worse. So anyway, if the counts go too low, then sometimes a drug may be stopped, or the dosage may be reduced. But there's usually not much else to do for low white cell counts. But infections are obviously something to be concerned about, are more often related to alterations in the body's immune system. So there you go. There's also an increased chance of lymphomas with lupus. The risk is higher too with those who have primary Sjogren's disease, and also for people who have rheumatoid arthritis than the general population. So that is about all I have for that. It's 11:45, so maybe I'll wrap up there. So blood involvement, just to kind of put a pin on it, with lupus can occur with or without symptoms. It's really important to get your blood taken every 3 months to detect any problems that might be on the rise. And as a lupus patient of now 34 years, I've experienced my fair share of blood complications. From a child to now, thrombocytopenia as a child, anemia in my adult years, and there's a constant monitoring of my low white cells. So I understand it's a lot to manage, but it's so important to be informed and to be aware of what's going on in your blood, because as the old hymn says, there's power in the blood. So let's just stay vigilant and make sure that you're getting those things checked, right? Yes. Awesome, guys. Well, let's be here, everyone. As I mentioned, anyone who writes shared in the comments will be entered into a drawing after this chat is complete for a little lupus prize. These prizes throughout the month of Lupus Awareness Month will be mailed at the end of the month, so I can be efficient with my time and do it all at once, okay? Because it's a lot of work to kind of put the packages together and get the shipments done. So there you go. I will do that as well. And here is your Lupus Live quote. Be the silent watcher of your thoughts and behavior. You are beneath the thinker. You are the stillness beneath the mental noise. You are the love and joy beneath the pain. Oh, I love that. I will send this to you right here. I thought this was so pretty. Nope, that's not what I highlighted. Copy. Thank you. Paste. There you go. And unfortunately, I feel like I need to log off a little early because I can hear our lawn guy is here and the puppies are outside and I don't want them to escape. But I just want to say hi to Carrie. Hi, Robin. Hi, Mari in Chicago. Hi, Sandra. Hello. Sopronia. Very pretty name. Happy to have you all here. Sorry about the plethora of distractions. These are live, so I can't really control what happens, but I try not to be that distracted. Holy cow. Please, guys, please, if you are local, come to the Edge Family Fitness this Friday, 6 and 7:30 for our Dance for a Cause. And also, too, we have our Take a Look for Lupus happening the next day, Saturday. Sunday, I'm going to be exhausted, guys. And if you can't be there, please consider donating to our lupus awareness fundraisers on Facebook, or also, we've got our actual donation link that is on our website. So please consider donating any way that you can. Every dollar matters. Every dollar makes a difference. Thank you so much. And I'm going to head out now, and I will see you soon. Okay, bye-bye.